Good morning, Mr. Jones. Good morning. I'm Keith. I'm going to be your student nurse this morning. Is it okay with you that I help with your care today? I've been assigned to you as a nursing student. Thank you so much. I appreciate that. Okay. I'm going to go wash my hands. I'll come back and I'm going to be doing your physical assessment this morning. Okay? Thank you. I'm in the bathroom. I'm washing my hands. Okay, Mr. Jones, I'm back. How are you doing this morning? Great. So before we get started, would you care to state your name and date of birth for me? Awesome. Well, happy birthday. Yeah. So, all right. It's okay with you for the assessment. I'm going to raise your head of the bed up, okay? So basically what I'm going to be doing, I'm going to start actually at your head and I'm just going to work my way down the body to do a complete head to toe assessment, okay? Are you okay there? Great. All right. Okay, before I get started with the actual assessment, the head to toe, I'm going to go ahead and take your vital signs, okay? All right. So using the manual blood pressure, sure it is all secure, not too tight, not too loose. Great. I'm going to palpate and feel for the brachial artery. What's that? Yes, sir. It was 132/84. Yeah, you're very welcome. And at this time, I will go ahead and do the rest of the vitals, the pulse and the respiration using any equipment that I have to do so. And with pulse rate, I'm going to ensure that I am feeling for the radial pulse. I'm going to feel for that radial pulse for 30 seconds and times that by 2. If it is by chance I feel any irregularities to that, I'm going to feel for 1 full minute. While I am maintaining my position for the radial pulse, I'm going to count the respirations at this time and not letting the patient know that I'm counting respirations. Jones, I'm going to go ahead and listen to your heart and your lung sounds, okay? And listen to your tummy as well, okay? So I'm starting with the cardiac sounds first. I want to feel for the second intercostal space. I'm going to be listening for the aortic. At this landmark, I'm hoping to hear the S1. Then we'll come straight across, and I am at the pulmonic. In this landmark, I am listening for the S2. Coming down to the third intercostal space, which is also known as Erb's point. Then down to the fourth intercostal space. This is the tricuspid. And then moving down to the fifth intercostal space at the left midclavicular line will be the mitral valve. And this is also where I would listen for the apical heart rate for 1 full minute. If you'll just breathe normal for me, and we'll listen to your breath sounds. Can you sit up for me just a little bit? Just breathe normal for me. Good job. Just like that. I'm going to let your head down just a little bit, and I'm going to listen to your tongue. Okay? All right. Starting at the right lower quad. And I should be able to hear something every 5 to 30 seconds, some activity. Moving up. Over to the left upper quad. And then down to the lower. If any time that I've determined that I did not hear any vowel sounds, I would listen for 5 full minutes before I documented absent vowel sounds. Okay, Mr. Jones, I'm just going to start right here at your head, okay? I'm just going to look at your hair and feel for any bumps, abrasions, sores, anything like that in your head. I'm also looking to the texture of the hair. Is it shiny? Is it dull? Is it matted? Is it clean? Is it dirty? Looks good there. I'm going to look at the ears, palpate them. Mr. Jones, can you lean your head to the side? I'm going to look in your ears. Okay. So I'm going to pull down and back on the pinna, looking in to see if there's any wax build up. Looking behind the ears for any pressure, any skin breakdown. Can you lean your head, turn your head that way for me? Thank you. Same, down and back. Looking behind the ear for any breakdown, redness. All right, Ms. Jones, can you turn your head towards me just a little bit? Thank you. Okay. Next one I'm going to do is look into your eyes. Okay, I'm going to pull down here and look in your eyes. I'm looking for the conjunctiva, not this pink. I'm looking for the sclera. Let's see if it's clear. And this eye. All right, I'm going to shine a bright light, in your eye, and then I'll take it away. I'm looking for perla here. I'm looking at the pupils to see if they're active, see if they're equal, round, and reactive to light and accommodation. There they are. Okay. Mr. Jones, can you follow this pin for me? Okay, just follow the pin as it moves. Good, very good. Okay, now if you don't mind, I'm going to look into your nose to make sure you don't have any blockages, okay? Here we go. So pull his nose up, look. Nothing there. Nothing there on this side. So I'm going to check for patency. So I'll apply pressure here and ask him to blow out and then breathe in. Same with this side. Have him to do the same. Breathe out. Okay, can you open your mouth for me? Okay, I'm going to shine a light in. So I'm looking at his oral cavity to check for moisture, dryness, if there's any lesions, cut, abrasions, to see if he has his natural teeth or if he has dentures, partials, anything like that. Do you have any difficulty swallowing? No? Okay, great. For your neck, can you move your head side to side for me? Good job. Okay. What about, can you take your chin down to your chest? Very good. And then can you lean your head back for me? Any pain or discomfort while you're doing that? Good. All right. So if you will for me, can you raise this, your right arm for me? Just like bend at your elbow. Good. What about this hand? Bend at the elbow. All right. Can you raise your hand up like this for me? And this one. Good job. Good job. Okay, here, can you squeeze my hands for me? Good. You got good strength there. Okay. I'm just going to squeeze here on your hand. Okay. I'm checking for capillary refill. For skin charter. Good skin turgor. No tinting noted. All right, now we'll check your capillary refill. I'm going to put a little pressure on your nails. Good rebound, less than 3 seconds. Good. Check this hand again. Now I'm just going to feel around on your neck, okay? Making sure you don't have any swelling or anything like that. And also, while I'm looking At him, I'm looking at all body surfaces to make sure there's not any breakdown, any swelling. Good deal. I'm just going to palpate some pulses. So his temporal pulses. And his carotid. Now the carotid pulses, you absolutely want to make sure that you palpate these individually. Doing okay? All right, good deal, good deal. Okay, I'm going to palpate, all right, actually I'm going to inspect your stomach and chest, okay? So I'm going to raise your gown up here. Just looking at skin surface, nothing there. So I'm inspecting his abdominal area. There. So now I'm going to gently palpate, starting at the right lower quadrant, up and over and down. I'm going to press about 4 to 6 centimeters or centimeters. Any discomfort? No? Good. No pain? All right. So can you tell me when your last bowel movement was? This morning. Okay, great. Good. Any difficulties with that? Any constipation? Anything like that? Okay. All right. Now, as far as your urinary pattern, okay, are you going to the bathroom okay? Any pain, discharge, anything like that? Are you going to the bathroom? Okay, great. That is great. Now, I'm going to ask a personal question here, if you don't mind. So, are you doing the monthly, or are you doing your monthly testicular checks? Okay. Any issues when do you do them when you're in the shower? Okay. Any issues? Have you felt any abnormalities or anything like that? No? Okay, good. And if it were a female patient, I would be asking her about her menstrual cycle, if she's had a recent pap smear. If, again, if it were a female, at this point I would ask about breast, if she's doing her monthly breast exams. When she does those, if she has found any abnormalities, any masses, lumps, anything like that. Also, I would ask the female if she's having any drainage from the nipples or the areola areas, and if so, has she reported that to her physician? All right, Mr. Jones, can you move this leg for me? Let me get it uncovered here for you first. Okay, can you raise this leg for me? Awesome. Can you bend at the knee? Good. Any pain, discomfort, anything like that? No? Okay. Can you just slide your leg in and out of moving it towards the body and out? Discomfort? Pain? Okay. Good. Good, good, good. All right. What about this other leg? I'm going to uncover it. All right. Can you raise this leg up? Okay. Can you bend at the knee? Good. Pain or discomfort? No? Okay. How about moving this one towards the inside and out of the bed? Any discomfort? No? Great. Good deal. Good deal. All right. Now I'm just going to palpate some pulses, okay? So, feeling for the brachial pulses. Now feeling for the radial pulses. Mr. Johns, I'm going to feel for your femoral pulses, okay? So I'm going to cover here just a little bit. Great. feel behind both your knees. Feel for the popliteal pulses. Bend them just a little bit for me. Thank you. Great. All right. Now we'll feel down here at your feet for some pulses. So the dorsalis pedis on the top. Good job. Okay. Mr. Johns, I'm going to put a little bit of pressure on your toenails here, okay? Checking again for capillary refill. Great. Good. Less than 3 seconds. Mr. Jones, I'm going to put my hands on the top of your feet. Can you pull your feet towards you? Awesome. I'm going to put my hands on the bottom of your feet. Can you press down on those? Good. Okay, you got good strength. Good strength. All right. I'm going to come back up here to your arms. Okay, I'm going to check this strength. So I'm going to have you, I'm going to press against your arm. You press down, okay? Good. I'm going to put my hand on the top and you pull up. Good. Come to the other side and do the same. Right, press down. Good. Pull up. Good job. Good job. All right, Mr. Jones. At this time, I would ask, I'm going to raise your bed rail. I'm going to lower your bed. Okay. I'm going to ask you to sit on the side of the bed for me, okay? And I'm going to have you stand because I need to check your balance, okay? So we will lower the bed, raise the bed rail, sorry. Lower the bed, and I would assist him to the side of the bed, and then give him some time in case he has any dizziness, and then we would stand up or check his balance. Excuse me. And then once his balance is good, I would ask him to walk a certain distance for me. At this point, I'm watching his gait to see if he has a good pattern of walking to test balance as well. Then I'm going to ask him to hold his arms out like this for me. And then I'm going to see if he has any neurological issues with swaying back and forth or whatnot. Okay. He does not, so I'm going to have him sit back on the bed. Okay, so he's sitting here on the side of the bed, and I'm going to go around to this side, and I'm going to be testing his hearing. Okay, so Mr. Jones, I'm going to say something. I just want to know if you can hear me. Okay, so he's sitting on the side of the bed for me, and I'm going to test both ears. Okay, 1, 2, 3. Did you hear that? Okay, what does it say? Correct. Okay. On this side, dog, cat, mouse. Did you hear that? Okay. Tell me what you heard. Dog and cat. Okay, great. Great job. Okay. All right, would you like to sit up in the chair for a while, or you want to lay back down? All right, we'll lay back down. So I'm going to assist him back into the bed, comfortable position. Here's your call bell, okay? Please ring out if you need anything. Is there anything I can help you with? Do you need anything? Water, some ice, anything like that? No? Okay. All right, I'm going to lower your bed. Mr. Jones, just a couple more questions for you. Can you tell me where you are? Yep, that's right. BCTC Hospital. Very good. Very good. Do you know what year it is? Yep, 2026. And do you by chance know who our president is? Yep, that's who we got. Okay. And do you know why you're in the hospital? Yes, that is correct. Yes. All right. to remove my gloves. And I'll wash my hands, push the privacy curtain back. Then I'm going to go wash my hands. And then if you need anything, you just push the call back and I'll come back. All right. Thank you, sir.